Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to discuss the topic of walking after knee replacement surgery, and in particular, we're going to talk about an inability to walk, feeling like you just can't walk after knee replacement surgery. Before I jump into that, be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos related to knee replacement surgery. So this is a very specific issue or concern. We kind of have to clarify between can't walk after knee replacement surgery in that you physically cannot walk, you are unable to take steps, compared to having difficulty walking. For most people, it's more I have a lot of difficulty walking. I have to use an assistive device. I can't walk very far. It's very painful. A lot of difficulties, and these can be very significant and very intense. But there also is a camp of individuals after surgery, usually, especially kind of in that early phase, first few weeks, first few days after surgery, who just cannot walk at all, or no more than maybe one or two steps after surgery. And this tends to be people who have a little bit more impairment going into the surgery. You might be older, you might have some comorbidities, diabetes, osteoporosis, things of that nature, and so probably a little bit more risk of having increased debility prior to your surgery already. So let's talk about this and what can we do and how do we approach this concern in this situation. So I'm going to talk about it first, and then if you want to move forward in the video, I show you in standing up a little bit of some of the exercises and activities that you can do to start to get back into walking. So if you want to skip forward to that part, go ahead. So really, why can't you walk depends on the underlying impairments, the underlying issue. And it could be multiple things. So obviously it could be pain, stiffness, it could be muscle weakness in your legs and your quadricep muscles of your thigh and your hip muscles. It could be a balance and instability or incoordination issue. It could be a lack of range of motion in your knee so that you can't bend and straighten your knee adequately to take those steps and to walk. So that's the first thing you want to look at. What are those underlying issues, those underlying impairments that are going to affect your ability to stand and walk? And we want to make sure that we're addressing those. So obviously through physical therapy, through different exercises and activities, through management, pain management strategies, trying to address the underlying issues is first and foremost what you need to do. The next thing is to basically start to try to stand and try to walk. If you want to learn how to shoot a bow and arrow, if you want to learn how to golf, whatever that may be, to learn a skill or to relearn a skill, you have to work back into doing that skill and trying that skill and practicing it. So really that's our goal. So how do we go about doing this? Well, one is we want to make sure your pain is under control. Try to time your pain management, if that's medicine, icing, other multiple modes of pain management. Time that up with when you're going to have your physical therapy or when you're going to be doing your exercises and activity, so that that pain is at the lowest we can potentially get it, so that you can tolerate doing these activities with a physical therapist or whoever that may be. So stay on top of the pain and time and plan that pain medicine and that pain management so that your pain is as much under control as we can possibly get it going into trying these activities. And we also just want to build up your confidence. Your knee replacement is strong, it's durable, and it can tolerate the stresses and the forces of standing on it and walking and doing regular daily normal activities. Now, all the things around it, your muscle strength, the swelling and inflammation, the pain, all that stuff is the stuff that's going to impair your tolerance with standing and walking. So that's the stuff that we're dealing with. But the knee replacement and the prosthetic itself, in 99% of the circumstances, is durable, it's strong, it's safe, and it's going to support what it needs to support, and it can tolerate this. So, the best thing we need to do is, like I was saying, progressively get into walking. So the first thing you got to do to walk is you need to stand up. You need to stand up on your feet. So for people who, are trying to get back into walking, the first thing I do is say, let's stand up. Now, usually this is with some support through your upper body, if that's parallel bars, if that's a railing, if that's the physical therapist holding on with hands, maybe it's a walker or crutches, but just getting up on your feet. You need to get comfortable with putting weight through that leg, and shifting your weight on and off that leg, putting weight through your foot, through your ankle, through the heel, through the balls of your feet, all these different movements. That is going to be the starting point. If you can't stand and put weight through that leg or move that leg to some extent, then you're not going to be able to take steps and walk. So that's the first part, is just start standing and kind of build up your duration, build up your tolerance. Work up to a minute, work up to 2 or 3 minutes, being able to stand up on your feet. Try to reduce the amount of upper body support you need. Try to increase how much you're putting your weight through that leg. And then from there you can do a couple things in standing, which I'll show you in the second part of this video. But basically, weight shifting, taking some steps in place, forward, backward, out to the side, just getting comfortable with different movements. And then what we got to do is we got to take some steps. We got to walk. So that might, again, start in a little bit less than what you're used to. So maybe that's in the parallel bars, holding on with your arms. Maybe that's using a walker and having the assist of a physical therapist. Whatever that may be, we want to progressively get back into the action and motion of walking. And for a while and for a lot of repetitions and maybe a number of days, we're just doing it with that upper body support and with that guarding from your therapist. And maybe it starts with a few steps. And then we try to work up to, we try to work up to 15, 20 feet. And then we go a little bit further, and just continue to build up that confidence, build up that tolerance of walking and standing and balancing. And then progressively, working with that therapist, we work back to getting you as much potential as we can. Hopefully transitioning maybe to a cane, transitioning to not using any type of assistive device, obviously transitioning to being independent with your walking, and just building up your endurance, how long you can walk, how far you can walk, things of that nature. And it takes time. I say this in a ton of my videos, but knee replacement surgery is a marathon. It's not a sprint. It's going to take time, especially if you're starting from a point of a lot of pain and weakness and stiffness. Then it's going to take time to build that up and get back. But the key is consistency, continuing to practice to get those repetitions and doing it little by little over time. So that's basically it. It's relatively, a straightforward, simple idea and plan. It's just putting in that time and that consistency of getting back into it and building up that confidence. So now we're going to transition this video, and I'm going to go ahead and show you a little bit of those beginning activities and exercises that you would do potentially with your physical therapist to get back so that you can walk after knee replacement surgery. Alright, so now I just want to go over a couple of beginning exercises or activities that you can do to start to improve your ability to stand and to walk after knee replacement surgery. So like I was saying before, really to be able to walk after surgery, the first thing you have to do is be able to stand and be able to put weight through your legs and your knees and your body and hold that position and balance and be steady. So I would recommend first thing is just trying to stand up, stand in place. You'll probably have a walker. I recommend having a therapist or someone there to guard you and to help you, and having a chair nearby if you need to sit. But just standing in place, standing maybe with some support, and try to work up your tolerance just to stand in place. You don't have to do anything right away, just standing on both feet. And work up to being able to stand maybe a minute, 2 minutes at a time. Once you're able to do that, then maybe try to start doing weight shifts, shifting your weight onto one leg and then to the other leg. So just shifting side to side. Again, we're still holding on to the walker. Maybe you're in the parallel bars, holding on to parallel bars. a railing, whatever that may be, still having that upper body support as you do this. But again, now we're putting a little more force through your surgical leg, trying to tolerate that, and switching sides. And you can also do that forward and backward. Forward onto the balls of your feet, backward onto the heels. And just get comfortable with that as best you can. Now, once you're able to build up some tolerance, maybe you can stand for about 2-3 minutes. You can weight shift side to side. Then you can also start doing just some steps in place. So again, holding on, upper body support, walker, parallel bars, and just taking a forward step and then back. And you can maybe do 10 on one side and then switch, or you can try alternating. And just practice getting that leg up and taking a good forward step, being able to shift your weight forward onto that foot and bring it backward. You can also do some marches in place, practicing again, having that weight on the leg, practicing that forward flexion movement of your hip as you step and walk, and just doing that as well. So really we're just trying to mimic a lot of the motions and a lot of the necessities of walking, but without actually walking. So kind of taking apart the pieces of walking, the swinging of the leg, so doing marches or doing some steps in place, the weight shifting, the push off, so pushing off as you step forward. You can also try going up and down on your toes a little bit as well. And then really the next step is just you have to give it a try. You have to walk. And it may be in the parallel bars, it may be with a walker and the assist of a therapist and the guarding of a physical therapist. But the best way to do it is just to start to do it. And it may be very short distances, and you take a break, and you go another short distance, and you take a break. But really just like anything else, it's practicing the actual task. It's building up that tolerance, building up that comfort. You may have pain, you probably will have some pain and discomfort, but just kind of trying to start to slowly work through it, progressively work through it. You don't have to go 0 to 100 right away, but just doing a little bit, lots of practice, lots of repetitions, and that's how you're going to get back to being able to walk and be able to walk effectively and efficiently and comfortably after knee replacement surgery. I hope you found this video helpful. Please be sure to hit that subscribe button, turn on the notifications so you can catch all of our latest videos. Please be sure to hit that like button, and always please be sure to leave your comments or questions below as I do my best to get back to everyone I see. Thank you very much for watching.